मुझे कुछ इमेजेस शेयर करने हैं तो आप कर सकोगे क्या?
Coming, waiting, one waiting already. Okay. मुझे बोलो।
So, hi everybody. Wishing you all a very, very, very happy Women's Day. So today it's my first Facebook Live and इसका जो मेरा सॉरी टुडे इज माय फर्स्ट यूट्यूब लाइव एविडेंटली सीन के फेसबुक आ रहा है मेरे मुंह में सो द थिंग इज कि मुझे ना ये बहुत टाइम से मन था कि आई वुड वांटेड टू डू अ लाइव एंड माय प्राइमरी रीज़न ऑफ डूइंग दिस लाइव इज़ मेरे पेशेंट्स जिन्होंने मुझे मोटिवेट किया है कि भाई बहुत सारे वुमेन्स हेल्थ के टॉपिक्स हैं जैसे पेल्विक फ्लोर हो गया, सेक्सुअल डिस्फंक्शन हो गया, यूरिनरी फंक्शंस हो गए, टॉयलेट फंक्शंस हो गए। इनफैक्ट जब मैं फेसबुक मैंने इनिशियली स्टार्ट किया था या तो फिर जब मैंने इंस्टाग्राम से मैं इंट्रोड्यूस हुई, आई रियलाइज़ कितने सारे वुमेन्स ग्रुप है। इनफैक्ट इवन व्हाट्सएप पे लेटली वुमेन्स ग्रुप बहुत सारे हो गए जहाँ पे फीमेल्स कम डाउन एंड आस्क सच सिंपल क्वेश्चंस जो उनको पता ही नहीं है कि किनके पास जाके पूछे। एंड व्हाट रियली ट्रबल्ड मी इज़ कि इनमें जिन्होंने सच में सफ़र किया है, वो बहुत अच्छे सजेशंस दे देते हैं, बट अपार्ट फ्रॉम दैट लॉट ऑफ थिंग्स आर जस्ट टेल्स जो हमें जो रियल अच्छी इन्फॉर्मेशन है भी नहीं, पर वो बिलीव करते हैं एंड बहुत ही कॉन्फिडेंटली फॉरवर्ड भी कर देते हैं। सो आई रियलाइज़्ड कि लेट्स मेक अ प्लेटफॉर्म जहाँ पे ऑल द फीमेल्स हू हैव सच क्वेश्चंस, चाहे वो आपके सेक्सुअल फंक्शंस हो, यूरिनरी फंक्शंस हो, चाहे आपको लगता हो कितने ही सिली क्वेश्चंस क्यों ना हो, एक ऐसा प्लेटफॉर्म बनाते हैं जहाँ हम आके इसके ऊपर बात कर सकें। एंड आई थिंक मेरे पेशेंट्स मेरे सबसे बड़े मोटिवेशन थे ये करने के लिए कि मैम कुछ करो ताकि हम कम परेशान हो बिफोर वी रीच टू द करेक्ट सोल्यूशन ऑफ द प्रॉब्लम्स दैट वी आर गोइंग थ्रू। सो आई होप कि मेरा आज का ये इनिशिएटिव can help you all get answers to such questions if you all have. So today is an open live. You all can put in your questions. As I said, मेरा पहला लाइव है, सो आई थॉट कि जितने मेरे पेशेंट्स के क्वेश्चंस हैं या तो जो मुझे मेरे फेसबुक के ग्रुप से मिले हैं या तो जो मुझे मेरे फ्रेंड्स से मिले हैं, वो भी क्वेश्चंस मैंने जॉट डाउन किए हैं। सो दैट क्वेश्चंस आल्सो वी विल टेक टुडे। आई बिलीव उसमें से भी शायद थोड़े बहुत आंसर्स आपको मिल जाएंगे। सो वी विल गेट गोइंग विद दैट एंड आई फील थैंक्स टू द मैच आई थिंक आप लोग की आज एनर्जी भी बहुत हाई होगी, राइट? सो इट्स अ वंडरफुल डे टू टॉक ऑन हेल्थ एज वेल। ठीक है, सो विल गेट स्टार्टेड। लेट्स स्टार्ट विद द फर्स्ट क्वेश्चन। ये क्वेश्चन बहुत कॉमनली आता है मेरे पास, दैट आई हैव डिलीवर्ड माय बेबी अराउंड 4 months बैक एंड आई स्टिल लुक प्रेग्नेंट, इज इट नॉर्मल? ना इसमें कुछ चीज़ें सबसे पहली कि अगर आपको लगता है कि डिलीवरी के बाद अभी भी आप प्रेग्नेंट फील हो रहे हो, लग रहे हो 4 महीने बाद, 6 महीने बाद, समटाइम्स आई हैव हैड पेशेंट्स जो 3 महीने, 3 साल, 5 साल बाद भी मुझे आके बोलते कि मुझे ऐसा अभी भी लग रहा है कि मैं प्रेग्नेंट हूँ, इवन दो आई हैव लॉस्ट ऑल माई वेट। So the first thing is 4 months is too early to start commenting on it. So give yourself some time. Of course you are not pregnant. Of course there is no gross problem. So मैंने बहुत commonly लोगों को देखा है कि मुझे मेरी चाची बोलती है या मुझे relatives बोलते हैं कि तुमने अच्छे से पट्टा नहीं बांधा होगा, अच्छे से मसाज नहीं किया होगा, या फिर you have not taken certain जड़ी बूटीज एंड दिस एंड दैट एंड इस वजह से आपका पेट रह गया, या तो तुम्हारा पीरियड्स अच्छे से क्लियर आउट नहीं हुआ, उसका कचरा रह गया। द फैक्ट इज जो भी आपको पेट दिख रहा है डिलीवरी के बाद, ये कुछ और नहीं है, सिर्फ फैट्स है एंड लूज मसल्स है। बिकॉज हमारे प्रेगनेंसी के फेज में जो हमारा बच्चा हमारे वूम में ग्रो करता है, तो धीरे 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 हमारे जो एब्डोमेन के मसल्स होते हैं उसको स्ट्रेच कर देता है। डिलीवरी तो 10 घंटे, 12 घंटे या 24 घंटे में हो जाती है, बट वो जो 9 महीने लगे वो मसल्स को स्ट्रेच आउट होने में, उसको वापस श्रिंक होने में थोड़ा-सा टाइम लगता है। आपका जो यूट्रस है, वो तो अपने आप श्रिंक आउट हो जाता है अपनी जगह पे 6 वीक्स के अंदर। इसलिए हमें लगता है कि 6 हफ्ते में एक माँ रिकवर कर जाती है, पर 6 हफ्ते में कोई भी माँ रिकवर नहीं करती है, सिर्फ़ उसका गर्भाशय उसके शेप में वापस आ जाता है। पर जो मसल्स लूज़ हो गए, उस पे आपको कसरत करके काम करना पड़ेगा। अगर आप वो नहीं करते हो, तो वो जो लूज़ एरिया है, वहाँ पे जो भी एक्सेस फैट्स है, वो जाके डिपॉज़िट हो जाते हैं। टिपिकली इंडिया थोड़ा रिच है डिलीवरी के बाद खाने-पीने में, एंड दैट कैन फर्दर ऐड ऑन टू एक्सेस फैट डिपॉजिशन आपके पेट के एरिया में, जो आपको फील कराता है कि भाई डिलीवरी के बाद सब तो चला गया पर पेट अभी भी रह गया। सो डोंट वरी, कोई मेजर डिस्फंक्शन नहीं है पेट रह जाना, इट इज जस्ट लूज मसल्स। कभी कभार वो मसल्स सेपरेट आउट हो जाते हैं, जिसको बोलते हैं डायस्टेसिस रेक्टाई। अगर डायस्टेसिस रेक्टाई है या नहीं है, ये आपको आपके कोई भी फिजियोथेरेपिस्ट चेक करके बता सकते हैं। पर इसको ट्रीट करने के लिए कोई भी सर्टिफाइड वुमेन्स हेल्थ थेरेपिस्ट आपको बहुत अच्छे से हेल्प कर पाएंगे कि इसको आप कैसे ट्रीट करो। मेरा सिर्फ एक सिंपल टिप है और सजेशन है कि एनी मदर हु फील्स कि भाई डिलीवरी के बाद मुझे लगता है मेरा पेट रह गया है, रादर देन हॉपिंग ऑन टू जिम एंड योगा एंड जस्ट स्टार्टिंग एनी वर्कआउट की करना है वेट लॉस, बेस्ट इज टू गेट योर सेल्फ असेस्ड। तो मैं मेरे हर एक पेशेंट को बोलती हूँ कि जैसे आप डिलीवरी के बाद 40 दिन के बाद अपने गायनेक के पास जाते हो, वैसे ही अपने फिजियो के पास भी जाओ। आप अपना पेल्विक फ्लोर चेक कराओ, अपना कोर चेक कराओ और देखो क्या इस पे कुछ काम करने की ज़रूरत है बिफोर यू मूव टू योर वर्कआउट्स। अगर आप इसमें डिस्फंक्शंस है, लूजनेस है और आप डायरेक्टली वर्कआउट स्टार्ट कर दोगे, तो वो जो इम्बैलेंस है बॉडी में वो सिर्फ वर्स होता है। एंड दैट इज़ द रीज़न दैट फीमेल्स जो वर्कआउट करती है, वेट लॉस भी कर लेती है डिलीवरी के बाद, फिर भी उनको मॉमी पूछ रह जाता है, बिकॉज वो जो सेपरेशन ऑफ एब्डोमिनल मसल है उस पर काम नहीं किया गया है। राइट, सो आई होप इट वॉज हेल्पफुल फॉर यू ऑल। इसमें अगर आपको और भी कोई फॉलो अप क्वेश्चन है तो आप इसमें ऐड कर सकते हो एंड आई विल रिप्लाई टू यू लेटर ऑन, है ना? Okay. The second question that I had got uh, is it okay to leak urine when I cough or sneeze? Is it normal? Now, in India, मेरे पास जो पेशेंट्स आते हैं तो आई गेट मदर्स एंड आई गेट देयर डॉटर्स, आई गेट मदर इन लॉज एंड डॉटर इन लॉज, एंड डॉटर इन लॉज एंड डॉटर्स आर करेंटली क्वाइट अवेयर हु कम एंड से कि प्रेगनेंसी में थोड़ा थोड़ा यूरिन लीक होता है, मेरा ब्लैडर फुल होता है, मैं खांसती छींकती हूँ तो लीक होता है, या तो डिलीवरी के बाद भी होता है। Now, is it normal or not? Yes, pregnancy में because of baby pressure, it is normal, but it should not be ignored because it also signifies कि आपका pelvic floor का muscle weak है, या तो फिर आपके बॉडी के कोर एंड पेल्विक फ्लोर का जो प्रेशर सिस्टम है वो कोऑर्डिनेटेड नहीं चल रहा है, इसलिए जब आपको सडन इंक्रीज होता है एब्डोमिनल प्रेशर जैसे एक्टिविटीज में, स्नीजिंग, कॉफिंग, एक्सरसाइजिंग में यूरिन लीक हो जाता है। सो दिस इज नॉट कंसिडर्ड एज अ बीमारी, but yes, this needs to be looked into and a certain exercise can help you to treat it. So can we tag it into normal? So that's one thing I want all of you to take away from today's session is that that is not normal. Because I've seen कि जैसे ये एक डॉटर या डॉटर इन लॉ बोलती है, वैसे मदर्स विल से हाँ इतना तो नॉर्मल है ना, मुझे उतना तो होता ही है। So the best thing we can do for ourselves is to not normalize urine leak, because urine leak अगर आपको early age में हो रही है और अगर आप उसको नॉर्मलाइज कर दे रहे हो तो एज के साथ ये बढ़ती जाएगी। बिकॉज यूरिन लीक का प्राइमरी कॉजेटिव फैक्टर इज कि आपका जो पेल्विक फ्लोर का जो मसल है, यूरिनरी एरिया का जो मसल है, जब वो कमज़ोर हो जाता है या तो फिर प्रेगनेंसी, लेबर वाली एक्टिविटी से ओवर स्ट्रेच आउट हो जाता है, तो आपको वो मसल वीकनेस की वजह से यूरिन लीक दे रहा है। अब आपकी जैसे जैसे एज बढ़ेगी, एवरी ईयर योर बॉडी इज गोइंग टू लूज सम मसल मास, जितना मसल मास लूज होगा आपके बॉडी से उतना ही आपकी प्रॉब्लम्स बढ़ती जाएगी। सो बाय द टाइम यू रीच 40, 50, 60, you will see that you have gross urine leakage, and that's the time when treating it becomes a little bit more difficult rather than treating it in early stage, right? दूसरी सबसे बड़ी कॉमन प्रॉब्लम मैंने देखी है इसके, लोगों को लगता है कि यूरिन लीक होना तो नॉर्मल है, उससे क्या ही होगा, पैड पहन लेंगे या तो फिर कम बाहर जाएंगे, कम पानी पिएंगे। तो फैक्ट इज कि ये सब चीज़ें करने के बाद भी सबसे बड़ी प्रॉब्लम कॉमनली फीमेल सफर इज कि उनको घड़ी घड़ी यूरिनरी ट्रैक इन्फेक्शन हो जाता है, जो वो मिस आउट कर जाते हैं। उनको लगता है कि कुछ तो रीज़न से घड़ी घड़ी यूटीआई हो रहा है, एंड दे डोंट इवन रियलाइज कि ये जो वेटनेस रह जा रही है ना थोड़े थोड़े लीक से, वही उनके यूटीआई का सबसे बड़ा कारण बन गया, क्योंकि वो वेटनेस बैक्टीरिया के लिए ब्रीडिंग ग्राउंड बन जाता है। So my humble request is कि let's make it a point कि let's not normalize urine leak. Urine leaking is not normal, but yes, it's easily treatable. है ना? So any questions? Okay, so I have one question currently on my chat as well. She's asking what's the best way to deal with swelling in pregnancy. सी प्रेगनेंसी में स्वेलिंग होने का सबसे बड़ा कारण ये है कि हमारे जो पैर के जो मसल्स होते हैं और हमारे जो पैर की ब्लड वेसल्स होते हैं, ये दोनों ही हमारे पैरों का ब्लड जो है उसको पंप करते हैं अगेंस्ट ग्रेविटी टू रीच टूवर्ड्स हार्ट, राइट? हमारा हार्ट कॉन्स्टेंटली ब्लड सर्कुलेशन करता है, राइट? ऑक्सीजन वाला ब्लड ले जाता है एक्सट्रीमिटीज़ की तरफ, डीऑक्सीजनेटेड ब्लड वापस हार्ट की तरफ ले आता है। सो ये जो कांस्टेंट सर्कुलेशन पैटर्न है, इसमें 2 बहुत इंपॉर्टेंट कंपोनेंट है, हमारे पैर के मसल की पंपिंग एंड दूसरी हमारी ब्लड वेसल की पंपिंग। हमारी जो ब्लड वेसल की जो इलास्टिसिटी होती है, वो प्रेगनेंसी में यूजुअली अराउंड 6-7 मंथ्स के बाद धीरे-धीरे लूज़न अप होने लग जाती है। बिकॉज़ हमारे बॉडी में एक हार्मोन रिलीज़ होना स्टार्ट होता है जिसका नाम है रिलैक्सिन। तो रिलैक्सिन हमारे ओवरऑल बॉडी को रिलैक्स कर देता है ताकि वो हमारे बॉडी को प्रिपेयर कर सके ईज़ी एंड स्मूथ लेबर के लिए। बट रिलैक्सिंग का खुद का तो कोई ब्रेन नहीं होता कि भाई मैं यहाँ जाके काम करूँ, यूट्रस के वहाँ पे, पेल्विक फ्लोर के वहाँ पे काम करूँ और बाकी सब जगह ना करूँ। सो इट स्टार्ट्स वर्किंग ऑन होल ऑफ योर बॉडी एंड दैट इज़ द टाइम कि आपकी जो ब्लड वेसल्स है वो भी लूज़ हो जाती है एंड इट डज़ नॉट एफिशिएंटली पंप आउट योर ब्लड टू द हार्ट एंड आपके पैर में स्वेलिंग होने लग जाता है। सो सबसे इम्पोर्टेंट चीज़ है कि कुछ-कुछ चीज़ें करिए कि वो प्रिवेंट हो, जैसे कि पैर लटका के बहुत लंबे समय तक मत बैठिए। अगर आप लंबे समय तक बैठ गए हो तो एवरी 1 टू 2 अर्ली मेक श्योर कि चेयर पे बैठे-बैठे ही दोनों घुटनों को स्ट्रेट करके यू कैन डू सम एंकल पंप्स। सो यू कैन डू अ 20 एंकल पंप फ्रंट एंड बैक, you can do some rotations clockwise and anti-clockwise. Try to do at least in a day 100 to 200 pumps. That will make sure कि भले अगर मसल थोड़ी सी वीक है या तो फिर ब्लड वेसल्स थोड़े से लूज है, बट अगर आप पंपिंग कर रहे हो तो एटलीस्ट आपका उतना फ्लूइड रिटेंशन वहाँ पे नहीं होगा। रात को जब सोते हो तो मेक श्योर करो कि पैर के नीचे आप 1 या 2 पिलो लगा के एक 10 मिनट सीधे सो जाओ। सीधे सोना टिपिकली प्रेगनेंसी में मना किया जाता है बिकॉज़ अगेन वी डोंट वांट कि आपके जो बड़ी ब्लड वेसल है जो आपके हार्ट तक ब्लड ले जा रही है वो लोड ना हो जाए, इसलिए वी वांट कि भाई आप सीधे लंबे समय मत सो। सो व्हाट यू कैन डू इज सीधे सो के ना पतला सा तकिया आप राइट बटक के नीचे रख दो सो दैट यू कैन स्लीप स्ट्रेट एंड देन पैर के नीचे 2 तकिए रख दो एक 10 मिनट के लिए। व्हाट दैट विल डू इज कि वो ड्रेन कर देगा जो भी पूरे दिन का आपका फ्लूइड पैर में इकट्ठा हुआ है। ये करने के पहले अगर आपको चाहिए तो थोड़ा गर्म पानी में पैर डिप करके रख सकते हो, ताकि जो फ्लूइड्स इकट्ठा हुए वहाँ पे थोड़े सॉफ्टन आउट हो जाए, ताकि जब आप पिलो पे पैर रखो तो वो अच्छे से ड्रेन हो जाए। सो एंकल पंप्स, रात को थोड़ा-सा हॉट वाटर फर्मेंटेशन फॉलोड बाय पैर के नीचे पिलो रखना विल हेल्प यू वेरी वेल। अनदर वेरी इंपॉर्टेंट टिप दैट टिपिकली पीपल मिस आउट स्वेलिंग मैनेज करने के लिए इज़ टू मेक श्योर लुक एट योर डाइट। अगर आपके डाइट में प्रोटीन का इंटेक कम है, देन देयर आर वेरी ब्राइट चांसेस कि आपके जो सेल्स हैं, वो पानी आपके एक्स्ट्रा सेलुलर मतलब सेल के बाहर छोड़ देते हैं। दैट इज़ द रीज़न कि फीमेल बॉडी में ऑलरेडी फ्लूइड ओवरलोड ज़्यादा होता है, प्लस अगर प्रोटीन इंटेक कम है, तो सेल्स का भी फ्लूइड ऐड हो जाता है। अब ये सारा एक्सेस फ्लूइड इज़ गोइंग टू गो डाउन इन योर लेग ओनली, राइट? सो मेक श्योर कि आपका प्रोटीन इंटेक अच्छा रहे, वाटर इंटेक अच्छा रहे। दिस विल आल्सो फ्लश आउट एक्सेस फ्लूइड फ्रॉम योर बॉडी एंड हेल्प यू मैनेज योर स्वेलिंग। Huh? I hope this answers your question. Um, okay, so I have one more question. This person is asking that I feel very tired in afternoon. Could it be because of my testosterone or diet? Now, सी टिपिकली अगर आपको आफ्टरनून में टायर्डनेस फील हो रही है टू पुट इट ऑन अ हार्मोन इज अ लिटिल ट्रिकी जस्ट बाय नोइंग दैट वन सिम्टम आई फील अ प्रॉपर गाइडेड असेसमेंट इज important if you feel it's your testosterone but diet yes could be one of the major reasons अगर आपको आदत है कि अगर आप सुबह उठ के नाश्ता नहीं करते हो और डायरेक्टली आपका आफ्टरनून मील होता है या तो फिर अगर आपका आफ्टरनून का मील थोड़ा सा हैवी होता है there are chances that the body feels sudden high with the excess food and then sudden low and that can make you feel a little tired just after your meals in afternoon. Second thing is that by afternoon if you feel tired for females I feel is do check into your vitamin D3 levels. बहुत बार हम हमारे vitamin D3 supplements अगर regularly नहीं ले रहे so this is one very common thing that I come across is के why do I need vitamin D3 you know. So every female or every human being as far as you're not going in sunlight it is always good to talk to your doctor once that do I need D3 or not but more or less आजकल के लाइफस्टाइल में जो लोग बाहर धूप में काम नहीं कर रहे D3 सप्लीमेंट्स सभी को लगते हैं एंड एवरी 6 मंथली उसके डोजेस लेने रहते हैं खास करके फीमेल्स के लिए जो प्रेगनेंसी के फेज में है पोस्ट डिलीवरी फेज में एंड मेनोपॉजल फेज में है पोस्ट डिलीवरी फेज में आई हैव सीन कि फीमेल्स टेक कैल्शियम प्रेगनेंसी में कैल्शियम मेनोपॉज में कैल्शियम या आप जितने कैल्शियम्स आप ले रहे हो सप्लीमेंट्स में अगर आपने विटामिन D3 नहीं ली है तो वो आपके बोन तक वैसे ही नहीं पहुंचने वाली एंड इट विल एंड अप क्रिएटिंग यू नो अननेसेसरी कैल्केनियल स्पर्स एंड किडनी स्टोन्स फॉर यू सो बेटर है कि मेक श्योर करें कि आप जब भी कैल्शियम सप्लीमेंट्स लेते हो पहले तो जानिए कि आपको सच में कैल्शियम सप्लीमेंट की ज़रूरत है या नहीं, बिकॉज़ बहुत तक हमारा जितना भी कैल्शियम का रिक्वायरमेंट है वो हमारे डाइट से आ जाता है। अगर आपका D3 का अगर इनटेक प्रॉपर है, तो योर बोन्स विल बी एनीवेज़ बीन टेकन केयर ऑफ। सो अगर ओल्ड एज में अगर आपको ऑस्टियोपोरोसिस, बोन पेन्स नहीं चाहिए, ट्राई करिए कि पोस्टपार्टम डिलीवरी के बाद मेक श्योर टू हैव योर कैल्शियम टिल द टाइम यू आर ब्रेस्ट फीडिंग प्लस 2 मंथ्स, डोंट स्टॉप इट इन बिटवीन। आई नो बहुत बोर होता है वो घड़ी-घड़ी पूरा साल लेते रहने के लिए। So take some support, keep some reminder, ask your husband to help you remind you, but please stick to your calcium supplements till the time you breastfeed and 2 months after, and make sure कि आपका D3 भी वो टाइम पे अच्छे से लिया जाए, so that आपके बॉडी के जो कैल्शियम रिजर्व्स है वो वॉश आउट ना हो जाए आपके बेबी को ब्रेस्ट फीड करने में। So I think for tiredness it's better to look out for your diet and D3 before we hop on to hormones, right? Um, राइट, सो वन पर्सन हैज आस्क्ड इन लाइन ऑफ दिस ओनली कि हाउ डू आई नो कि मेरा बोन डेंसिटी ठीक है कि नहीं है, एंड मुझे विटामिन D3 लेने की ज़रूरत है या नहीं है। सो एज आई सेड, विटामिन D3 की ज़रूरत है या नहीं है, इट्स ऑलवेज गुड टू गेट वन टेस्ट डन बेसलाइन, जानने के लिए कि आपका विटामिन D3 का पैरामीटर क्या है। सेकंड, मेक श्योर करें कि आपकी लाइफस्टाइल कैसी है। अगर आपका बिल्कुल भी सनलाइट एक्सपोजर नहीं है, देन येस डेफिनेटली विटामिन D3 रिक्वायरमेंट रहेगी ही। थर्ड थिंग इज कि बोन डेंसिटी के बारे में जानने के लिए देयर इज़ अ टेस्ट कॉल्ड बोन मास डेंसिटी, और BMD डेक्सा टेस्ट बोलते हैं। ये हर एक लेबोरेटरी में यू विल इजीली फाइंड इट इन योर एरिया। इट्स कॉल्ड BMD डेक्सा टेस्ट। आप ये करवा सकते हो अपने लिए, BMD डेक्सा स्कैन, एंड दैट विल टेल यू कि आपकी बोन डेंसिटी कैसी है, एंड देन फ्रॉम देयर यू कैन स्टार्ट वर्किंग इट टूवर्ड्स, डिपेंडिंग ऑन कि आपका रिपोर्ट क्या आता है। I have next question which says, why does it pain so much in my breast in pregnancy, and what can be done to reduce the pain? So see, pain during pregnancy can happen because of hormones. उसके पेन मैनेज करने, अगर आपको बहुत ज़्यादा अबनॉर्मली ज़्यादा पेन हो रहा है, तो मैंने कॉमनली ऑब्जर्व किया है कि प्रेगनेंसी में यूजुअली इट इज़ द ब्रा साइज़ और द ब्रा दैट यू आर वेयरिंग दैट नीड्स टू बी लुक्ड इनटू, अगर आपका पेन मैनेज नहीं हो रहा। प्रेगनेंसी में ब्रेस्ट हेवीनेस होना, पेन होना इज़ वेरी, वेरी नॉर्मल, बट लॉट ऑफ टाइम वी मिस आउट कि यूजुअली अराउंड 1 साइज़ प्लस हो जाते हैं हम प्रेगनेंसी में, एंड वी बिकम समटाइम्स +2 when we deliver and we start with breastfeeding. These are the times that we need to check that is our bra really tight for us, and that could become one of the major causative factor for pain. So you can just check कि आपके जो bra के straps है, do they really itch, do they become red, और you feel straps जो आपके ऊपर है वहाँ पे भी अगर आपको redness हो जा रही है, and you feel कि आपने bra निकाल दी, उसके बाद आपका पेन थोड़ा सा कम हो जा रहा है, probably that is the missing link. Another thing you can always do is you can apply ice packs also to manage the tenderness of the pain. अगर ये पॉजिटिव फैक्टर नहीं है, तो इट्स जस्ट प्योरली hormonally, and in that case you can always use ice pack, and still if it is not settling, then I think you should talk to your obstetrician regarding the same. Yeah. So I have a question that is asked, is it normal to run to the bathroom the second I get home? So this is typically called key and chain, key and lock incontinence. ये भी एक तरीके का यूरिन लीक जैसा ही होता है, पर यहाँ पे यूरिन लीक होता नहीं है। यहाँ पे ऐसा है कि हम घर से बाहर निकले नहीं, उसके पहले हमें वॉशरूम जाना है, और घर पहुँचे तुरंत ही हमें वॉशरूम जाना है। इनफैक्ट टिपिकली फीमेल्स कम एंड टेल मी कि मैं जैसे चाबी के अंदर लॉक डालती हूँ, जो पुराने ज़माने में होती थी की एंड लॉक वाली चाबी, जैसे हम लोग लॉक में की डालते हैं, वैसे हमें लगता है नहीं वॉशरूम तो जाना ही पड़ेगा, अब नहीं रुका जाएगा मुझसे। सो दिस इज़ थोड़ा बहुत बिहेवियरल, क्योंकि हमें पता है कि हमारे मसल्स वीक हो गए हैं। सी द थिंग इज़, ये जो लीकिंग वाली प्रॉब्लम होती है ना, ओवरनाइट नहीं होती, इट डेवलप्स ओवर अ पीरियड ऑफ टाइम। सो धीरे-धीरे यू विल स्टार्ट ऑब्जर्विंग कि मैं रात को उठ-उठ के वॉशरूम जाने लगी, जब मैं पहले एकदम पूरी नात रात सोती थी, अब मुझे रात को कम से कम 1 या 2 बार उठ के वॉशरूम जाना पड़ता है। या तो मुझे आदत पड़ गई है कि घर से जाने के पहले मैं एक बार वॉशरूम चली जाऊँ। अच्छा, कोई और जा रहा है, उसके साथ भी मैं एक बार सेफ साइड जाकर आऊँ। तो ये जो सेफ साइड वाले मेजर्स जो स्टार्ट होते हैं आर द अर्ली साइंस दैट टेल्स योर ब्रेन दैट माय मसल इज़ नॉट कोऑपरेटिंग मी द वे इट वाज़ कोऑपरेटिंग अर्लियर। सो ये जो टिपिकल लॉक एंड की वाली है कि भई घर पहुँचते ही भागना है, वो इवेंचुअली एक हैबिट बन जाती है। दैट इज़ द वन दैट गिव्स यू सडन अर्ज कि मुझे वॉशरूम जाना है। सो इसमें मसल स्ट्रेंथनिंग तो डेफिनिटली काम करेगी ही, बट थोड़ी-सी बिहेवियरल ट्रेनिंग विल आल्सो हेल्प यू टू गेट आउट ऑफ दिस कंसर्न। So yes, I would again not call it normal. It is very easily treatable, but it's just a little mild dysfunction. Okay, so I have one question. That person has asked me, can you suggest me something for constant fatigue? So I think constant fatigue again for females predominantly is make sure that you are taking care of your vitamin D3 supplements. If your vitamin D3 supplements are taken care of, then the next thing is make sure that you take care of your hydration. आप कितना पानी पीते हो दिन में? लॉट ऑफ द टाइम्स यू फील मैं तो बहुत पानी पीती हूँ, बहुत पानी पीती हूँ, बट द टाइम यू स्टार्ट कीपिंग अ बॉटल विथ योर सेल्फ यू विल गेट अ रियलिटी चेक कि एक्चुअल में आपके पूरे दिन में कितना पानी जा रहा है. सो द थिंग इज लॉट ऑफ टाइम पीपल आस्क मी कितना पानी पीना इज normal. I think I had a question that as well, that how much water intake is good for your bladder. So the simple math is that if you don't have any kidney conditions, if you don't have any heart conditions, or your doctor has not asked you to restrict your water intake, then bare minimum of 20 to 30 ml of water per kg body weight is bare minimum needed. So let's say कि अगर आप 50 किलो के हो इंटू 30 मतलब 1500 ml, 1.5 लीटर पानी तो आपको bare minimum पीना ही पीना है. But to feel a little brighter and to make sure that you, if you're feeling constantly tired and fatigued, again for females I'm not very keen on just day later. I feel that even to take care of the good flushing out of your bladder also, I feel at least 2.5 is a sweet spot. Again, if you're trying to lose weight, then 2 to 3 liters is a phase where you can be. So water intake is another very, very important component. If you are dehydrated, you can still feel constantly fatigued. The third very important component is sleep. How many hours you sleep and when you sleep. There are a lot of times when people say that yes, I get good 8 hours sleep. And when you ask them when do you sleep, they'll say I'll sleep at 1 o'clock and then I wake up at 9 o'clock. Then that is also something that does not match to our normal circadian rhythm. हमारा शरीर typically सनराइज के साथ उठने के लिए बना है एंड सनसेट के साथ ढलने के लिए बना है. सो इसमें अगर आप बहुत ओवरनाइट पुश करते हो तो कभी कभार दैट कैन ऑल्सो बी वन ऑफ द कॉजेज. इनफैक्ट दैट इज ऑल्सो वन ऑफ द कॉजेज टू क्रिएट अ लिटिल हार्मोनल इम्बैलेंस इन फीमेल्स. सो आई थिंक फॉर फीमेल्स थोड़ा सा सर्कैडियन रिदम के साथ चलना रियली हेल्प्स देम टू गेट अ गुड हार्मोनल बैलेंस एंड दैट कैन ऑल्सो हेल्प यू टू मैनेज द फटीग. एंड द लास्ट थिंग इज दैट इफ़ यू फील दैट ये सब करने के बाद भी आपका फटीग परसिस्टेंट है, देन द की इज़ दैट थोड़ी बहुत फिजिकल एक्टिविटी. आई एम नॉट सेइंग कि आप जिम चले जाइए या वर्कआउट करिए, बट जस्ट अ सिंपल स्ट्रोल और वॉक can really help you because it will start releasing happy hormones in your body, which can take care of maybe high stress, or it can take care of कि भाई हम चाहे कितना भी चले कोशिश करें हमारी नाइट रूटीन ऐसी ही है. In such cases it can really help you to combat with the negative hormones and can give you a little bit, it will start making you feel lighter and brighter. In fact, the same thing applies to pregnant females also. I so commonly have pregnant females who walk into my clinic at 6 months and 7 months and then they come and say मुझे तो होता ही नहीं है, मैं उठ ही नहीं पाती हूँ, मैं उठती हूँ और वापस सो जाती हूँ, खाना खाती हूँ और सो जाती हूँ. The thing is that more and more you rest in such phases, you feel more tired. So that implies to both the situation. If you feel that you're working all on your health, but still you feel more tired, maybe what is missing out is activity. So do not start with again a very strenuous and heavy activity. आज मेरा मूड बहुत ही अच्छा है और मैं जिम में जाके 1 घंटा वर्कआउट कर लूंगी. You will again crash. Rather, build up slowly. Start with simple stroll at 15-20 minutes, gradually build it to 30, then 45 minutes, and then move to some workout that will become more sustainable and doable. Again, finding a buddy really helps you to keep motivated, not only to give you a good mobility, but to also to, pep up your mood as well. So I hope that helps. Okay, so I have a question which says, why do I feel that I haven't completely emptied my bladder after I go? So this is again a little underspoken, but quite commonly found concern where I have seen not only females, it happens with males as well, where they feel they went to washroom, but they have not completely cleared their bladder, and they have to keep going again and again. Sometimes they go immediately 5 minutes later, or they run in next 30 minutes. So if you feel that you, after passing urine or passing toilet, you feel that you have not completely passed, or you have to strain while passing urine or toilet, or you feel that suddenly your urine frequency has increased, like not suddenly in the sense suddenly can be UTI, but over a period of time you feel earlier I used to just barely go 5-6 times, but now I just have to go again and again and again, and I'm going way more than 10 times in a day to washroom. There are chances that there can be other pathologies also, so it's good to get it properly assessed. But usually 70% of the time we have seen is that it's just pelvic floor tightness, and this tightness lately we have seen is coming a lot with the personalities that we are. So typically in type A personality people, people with high stress workload, these are the ones where we see that people end up hoarding tension in their pelvic floors. So you might have commonly seen people, right, who say, "Okay, my neck always hurts, and I was very stressed out, and my neck started hurting." So there are three common areas in our body where we end up hoarding stress. One is the jaw. These are the people who complain of jaw clenching. Second is the neck area, and third very common area is the pelvic floor area. And when we keep that area very tense, or where we hold tension, we end up tightening that muscle, and we need to relax that muscle to completely evacuate our urine, as well as to completely evacuate our bladder as well as the bowel. So अगर वो मसल completely relax नहीं हो रही है, then you will end up retaining a little urine inside, and वो आपको जल्दी से वापस urge दे देगा, क्योंकि bladder कभी खाली नहीं हुआ था, तो वापस जितना urine भरेगा, it will give you an urge कि मुझे वापस washroom जाना है. So in this case, please do not ignore it. Go and talk to your urogynecologist, or you can also talk to a pelvic floor rehab specialist. They both can help you out that why do you have it and what you need to do further. Okay, so I have a question that do I really need to do core work if I'm already lifting weights at the gym? This is one question which has so many questions in it, right? So first thing is, let's talk about lifting weights. I feel that lately there are two things which are very easily available. One is yoga, and second is weightlifting. My building has gym. I have weights in my house. It's like absolutely easily available. So the thing is, every time when you lift weight, your core works. But it will only and only work when you know the art of coordinating your core along with your weightlifting. Now, this art is very, very important. So, what you actually need to do is that you need to breathe out when you lift your weight. And this, I think, mostly your trainers would have told you, or you would have heard from so many people. Why do we need to do this? Because every time when you blow out, your core muscle braces a bit, as well as your pelvic floor also braces a bit. And that helps you to work your core accessorily, even when you are working on your, let's say, on your hands or your legs. But the thing is that just by doing this, and if I don't do core, is it fine? Then I would say that's not the answer. So, yes, your core always works when you lift weight, but if you lift weight with the correct technique. But you cannot completely rule out the core workout, so you need to do the core workout. Now, why so? Because core in itself is a huge muscle, and core is very poorly understood. We always feel that core is our Hrithik Roshan's six packs that we see, but the core are not that alone. Core is actually a combination of four sets of pillars. So your Hrithik Roshan wala six pack is the first pillar, the back muscle is the second pillar, your pelvic floor down is the one pillar, and your diaphragm. It's a muscle that separates your lungs from your abdominal organs. That is the fourth pillar. So ये जो चारों pillar है, they form a soda can like structure, and they are the ones that together in sync work as core. So when you are just lifting weight, your core just braces. So yes, it does work. But if you want to work on a stronger back, you want to work on your strong pelvic floors, you want a nice strong core muscle, then of course you need to do a core workout as well. So good combination of full body workout with a day for a core along with it is a very good option to do. So there's a question that says, what is the best way to lose belly fat without losing my strength? So you never lose strength when you lose belly fat. You lose strength while losing belly fat is when you lose fats in a very poor method. Now, what are the poor methods? Poor methods are, sudden keto, GM diets, extreme diets. These are the ones. In fact, to some extent, the current new pandemic of Ozempic and Monjaro, these drugs, all of this, anything that's going to give you a rapid weight loss is the one where you are losing muscle strength along with losing fat. I'm not sure it's a belly fat. So belly fat you cannot really targetedly lose, right? Body has a tendency that whenever you do a weight loss program, wherever there is excess fat, the body will start losing from that area the first. Most commonly, it is usually the breast, it's usually the buttock, it's usually abdomen. A lot of time, it's even face, right? So, a targeted fat loss in itself is a myth. You cannot really achieve that. But a systematic protocol of proper supplementation of protein, gradually working out, the more and more you build muscles, the more and more your body needs energy to build muscles. It's going to derive it from burning fat, and you will automatically burn fat. So, if a healthy way to lose fat, where you are making sure that your nutritional part has been taken care of and the exercise part has been taken care of, you will actually gain strength when you lose weight. You will actually not end up losing your strength. So, a rapid weight loss, yes, but a proper systematic protocol, the answer is no. You don't lose any strength while losing belly fat. Okay. Um, okay. I'll take some more questions. Just give me a minute. Right. Right. So I had this one question earlier which said that, do I need collagen supplements for my pelvic organ prolapse? Or, now this is a very, very nice question. The thing is that, see, I do understand. Now, what is a pelvic organ prolapse? Pelvic organ prolapse is कि आपका जो vaginal area है, वहाँ से you might feel something popping out. Sometimes it's appreciably felt, sometimes you just cannot feel it always, but when you strain while passing motions or when you lift something heavy, you feel that something is popping out, which is classically called as pelvic organ prolapse. Now, prolapse typically happens because of failure of two systems. The first system is कि आपके जो organs जो पेरिनियम के अंदर बैठे हैं, pelvis के अंदर, जब उनके ligaments weak हो जाते हैं, that is the time that the organs shift a little down. सेकेंड थिंग इज कि ये ऑर्गन्स को उसकी जगह पे रखने के लिए आपके पेल्विक फ्लोर मसल्स नीचे से उसको स्टेबलाइज करते हैं. अगर ये मसल भी वीक है एंड देर इज अ लिगामेंट स्ट्रक्चर विच इज फेलिंग, देन योर ऑर्गन्स विल फर्दर स्लाइड डाउन, राइट? सो इसमें यूजुअली ओरल कोलेजन या ओरल सप्लीमेंटेशंस कैन हेल्प यू नथिंग, बिकॉज ना वो आपकी लिगामेंटल स्ट्रक्चर को रीबिल्ड कर पाएगा एंड ना वो आपके पेल्विक फ्लोर को बेटर कर पाएगा. हाँ, जो आपके करंट स्ट्रक्चर्स है उसकी हेल्थ बना के रखने में मे बी इट कैन हेल्प यू मार्जिनली. पेल्विक फ्लोर में जितना कोलेजनस टिश्यू है उसकी हेल्थ का थोड़ा ध्यान रखने के लिए इट कैन हेल्प यू मार्जिनली, but the supplement that you take and the quantity needed and the amount of time it needs to make sure that it starts building up, it's very, very vast. So as a part of treatment of pelvic organ prolapse, collagen practically does not have a good role to play. What can really help is a good pelvic floor rehabilitation or a good pelvic floor strength can really help you to make sure that either you can reduce the prolapse as much as possible, or it can make sure that it does not progress further. And let's say worse come worse, in a very old age, if you have to operate that, it will make sure that you do not end up with a relapse. So pelvic organ prolapse is the only one where you will see the relapse is seen maximum. So the study says that there are almost 37% surgeries which end up into relapse. So again, the prolapse comes back over a span of maybe 3 to 5 years. And I typically tell all my patients that it happens because still your pressure systems are not corrected. Your pressure systems मतलब कि आपके कोर और आपके pelvic floor का coordination अच्छा नहीं है. So even though आपने operate कर दिया, आपने वापस organs को ऊपर fit in कर दिया surgery करके, but still every time when you lift weight, still every time you breathe, even breathing in itself also needs a good coordination. Or even when you're passing motions or you do your day-to-day activity, if your coordination with your breath in itself is poor, तो जहाँ पे pelvic floor को brace करना है वो pressure के साथ नीचे push करेगा and it will end up becoming a major cause for relapse, right? So for prolapse, I think the two main stems of the treatment are the primary one, जब conservative है तो pelvic floor rehab, and eventually if nothing works then surgical. And then maybe in recovery phase you can always add collagen as a supplement or a help. Yes. So I have this question which says, is it true that holding my pee can actually hurt my bladder muscles? So yes, it is very, very true. There are two things that your bladder really does not like. The first one is to not drink water because I'm not going to be able to find washroom for some time. This is the worst way to manage urination by not drinking water, because when you don't drink water, your bladder is again getting more irritated, you end up making more concentrated urine, you can get dehydrated. Again, that also becomes one of the causative factor for recurrent UTIs. And second is that, if you hold your pee, so let's say I've seen a lot of females ki chalo, I'm drinking water, no problem, but if I have to use a public washroom, I will not use the public washroom and I'll end up holding it for long. The longer and longer you hold, that full, see, typically you get an urge of passing, strong urge of passing urine maybe around at 200 to 300 ml. आपका जो bladder है वो bladder की अपनी, it's a bag, right? वो bag की अपनी एक capacity है, and that capacity is anywhere between 200 to 400 ml for person to person, and depending on their area. And so it depends on Indians, Caucasians, everyone has a little bit of different capacity, but it somewhere ranges between 200 to 400 ml. Now, in these circumstances, your body is going to give you a strong urge कि मुझे washroom जाना है. It will come anywhere around between 200 to 300. So it means your bladder is full. In this, if you end up holding for maybe an hour or two, there are two things that you end up causing trouble to. The first, वो जो urine stagnant रह जाता है, that also creates a upper urinary tract infection. सेकेंड इज कि आपने जितना टाइम उसको होल्ड किया उतना टाइम आपका पेल्विक फ्लोर कॉन्स्टेंटली टाइट एंड टेंस पोजिशन में था. This is the time when you start getting pubic pain. This is the time when you go to washroom, your muscle is not able to relax, so you will not be able to completely empty also, and that can start creating a cycle of UTI या तो a cycle of incomplete urination. So I have had a lot of patients who come to me, that day when I did this, when I was traveling, and then since then it has started. So it's not a really great idea to hold urine. Rather, public washroom mein chale jana is more safer. There are always better alternatives available in the market to, safely use the public washrooms. So rather keep that in your bag, or it's absolutely fine using the public washrooms, but do not hold your pee for very, very long, right? That can create a lot of problems. Okay, so I have a next question which says, can physiotherapy help me to prepare for a smoother labor or to prepare me for delivery? Absolutely. I think this is one component which is grossly missed when we talk about role of physiotherapy during pregnancy. So हमें लगता है कि भाई स्ट्रेंथ के लिए, वेट के लिए, कोर के लिए, सब चीज़ों के लिए तो वर्क करता ही है, फिजियोथेरेपी और एक्सरसाइजेस, लेट्स से. But for your labor, it plays the biggest role. Now, what is the role during labor? So, if you look at your pelvic floor muscle is around the urinary and the toilet area, right? Now, this muscle is almost like a jula, right? This muscle needs to relax when you want to deliver your baby. Now, the key is that the only muscle which is strong will relax completely. We always feel कि भाई मेरा मसल तो बहुत टाइट ही है, हमेशा टाइट ही रहा है. अगर आपका मसल रैंडमली बहुत ही टाइट है, इट मीन्स कि उसके पीछे कुछ तो पॉजिटिव फैक्टर है. Either there is something which is irritating it and making it tighter, or most commonly it is the muscle which is weak, which is trying to guard its organs, or it's trying to do its job with help of tightness. So if your pelvic floor muscle and your core muscles have not been worked during pregnancy, then this muscle ends up being weaker. The time when you have to relax for the to deliver your baby is the time when your muscle will actually tighten up, creating more pain and creating longer labors for you. So actually, to achieve a good relaxation, you need to make sure that you've worked on your pelvic floor. So उसकी strength के साथ कॉन्शियस रिलैक्सेशन, ये दो चीज़ें हैं जो आपको सीखनी है अपने प्रेगनेंसी के फेज में टू गेट अ बेटर लीवर. सेकेंड थिंग इज दैट ये जो झूला है आपके pelvic फ्लोर का, दिस ऑल्सो हेल्प्स द बेबी टू एंगेज इन टू अ करेक्ट पोजिशन व्हेन द बेबी हैज टू बी डिलीवर्ड. So if you see, all the babies get delivered in the same way, right? You never see one baby's hand coming out, other one's butt coming out. It's always the head coming out first. The nose is towards the tailbone. The head is towards the pubic bone, right? So ye position is the starting position that baby needs to achieve before the baby comes out. So what the baby does is that baby starts hitting your pelvic floor. You might have even felt it during the end of your pregnancy that suddenly I feel a lot of pressure down. So what your baby is trying to do is it's trying to come into a correct starting position in order to be delivered. Now you imagine if this pelvic floor is weak, it will. Okay, now let's talk about, okay, chalo, how will it help me to get my baby into a good position? So your pelvic floor almost works like a trampoline. Okay, so what does a trampoline do? Trampoline does is like wherever you jump, it will bring you back to the center, right? You all have seen in your bounce and all the places where you see people jumping. Wherever you jump, you come back to the center. So your pelvic floor also works like a trampoline to get the baby into starting position. So every time the baby hits down, it needs to come to the center. And if your muscle is very weak or if it is very tight, either of the situation, it will not allow the baby to come into a good position earlier, and that can also prolong the length of your labor. The third thing is to manage the pain, right? So let's take a very simple example. We all have had our first days in gym, right? When we all have gone and we feel, okay, let me just go do the treadmill and do some 20 squats, and then I will start. You did today your gym and you did your 20 squats and you went back home. The next day when you went, you realize you're barely able to walk. Your walking pattern has changed. Everything is paining. Sitting is paining. Standing is paining. And you see your friend along with you who is lifting weights with, doing squats with 100 kgs. And you're like, dude, isko kuch nahi ho raha hai. The only difference between you and your friend was that her muscles are trained. So your pelvic floor muscle is also very similar to your buttock muscle and your core muscle. It needs to be trained. If it is not trained, it will pain just like the first timer. And if it is trained, it will not pain as bad even when you lift 100 kg weights, right? So for better pain management, for better management of the duration of the labor, and to make it a little short and sweet, absolutely physical therapy makes a lot of help. It gives a lot of help. Again, it can help you with positions, comfort measures. There are a lot of things in which physical therapy can help you to make your labor smoother and better. In fact, I can spend a whole day just on labor given chance. I'll try to make it as short and sweet. Okay. So I have this question which says, why is it so hard to keep my muscle mass at age of 40s and 50s? So as I said that, after age of 30, our body starts losing 1% lean muscle mass every year. It's just part of aging. Till 30 we all are building, and then after 30 we all are depleting. It's not very hard. Condition apply that you take care of two things. Body has tendency to lose muscle mass as we age. What can we do so that we do not lose it? One is give it some work. When you move it, that's the only time that the muscle feels that I'm needed and it will not go on a leave. Second is that when the muscle is working, you need to give it food also to work, right? So a good dietary supplement, not the dabbas that you get supplement, but a good diet protocol that you can follow from home, ghar ka bana khana, along with some exercises. These are just two simple formulas to make sure that you don't lose muscle mass at age of 40 and 50. So the answer is very simple, little difficult to do, because the only thing needed is compliance. So I tell all my patients that the pregnancy is one phase that if you make it a part of routine, maybe the newer generation will not struggle so much to make exercise and healthy eating as a part of their lifestyle. I think we being evolved from farmers' land and now moving towards the Western land, I think it's missing in our culture to work out every day. And that is the reason that we all struggle. I want to do, I can't do, I want to do, I can't do. But the intention should not be that I do it only for myself. The intention should be that my next generation, that my whole family has it as a part of routine. That exercise is just like every day. The way you bathe, the way you go to work, you exercise. I think that's more than enough. And a good healthy ghar ka khana, more than enough to take care of things. So there is this question which is, I have a lot of pain in my bones. Can you suggest me some food or exercises that can do? So pain in bones, again, I think the first thing, if you have a lot of pain in your bones, you feel it in your joint, then please get your BMD DEXA scan done. Make sure that you are not osteoporotic, or your bone density is not grossly low. If that is the case, then the food alone will not help you. You will need some help. You will need some medication. You will need to follow a certain regime to recover. If you do your scan and you realize no, everything is just fine, I'm having a lot of bone pain, then make sure that your D3 supplements has been taken care of. These two are non-negotiable. If both of this have been taken care of, and then we talk about the food part of it, I think bone pain, make sure that your food, like which is milk, buttermilk, curd, make sure that your protein diet, I would not say a very high protein diet, but at least make sure that in every meal there is some protein which has been included. So I always tell my patient that don't try to make it very complicated. Just take a very simple example कि घर पे पोहा बना है तो पोहा के अंदर ही एक मुट्ठी आप स्प्राउट्स डाल लो, उसके साथ एक छोटा कटोरी दही ले लो. दैट इटसेल्फ विल टेक केयर ऑफ कि आपका कैल्शियम भी ले लिया आपने, आपका प्रोटीन वाला हिस्सा भी कर दिया, आपका कार्ब्स भी हो गया, एंड आपका जो मील था वो पूरा कंप्लीट हो गया. So try to see your meal before you eat, and if you feel any component is missing, usually curd, buttermilk, or sprouts are very easy additions that can be done in most of the meals, and that can really help you take care of your bone pain wala part. With regards to exercise, the best exercises for females who have bone pain is, once they have screened out that they are not grossly osteoporotic, is to start with weight bearing exercises. So your exercises like cat and camel, or to do your exercises like bridging. Again, it's better to be done under at least a couple of sessions to be done under a physiotherapist, so that they can see what you can do, what you cannot do. A lot of time we feel it is bone pain, but it can just be other pains which are just coming from your spine. So we really underlook the spine. We feel कि spine सिर्फ back pain, neck pain देता है, but spine is the origin जहाँ से आपके पूरे शरीर की नसें originate होती है. So if you have back pain and neck pain also along with it, that can also give you hand pain, leg pains. So it's better कि at least एक बार या दो बार आप अपने फिजियोथेरेपिस्ट से कंसल्ट कर लो कि आपके पेन का सोर्सेज क्या है, एंड देन अकॉर्डिंगली एक सिस्टमैटिक रिजिम ले सकते हो. बट इफ यू फील योर पेन्स आर जस्ट प्योरली बिकॉज ऑफ द bone pain, then weight bearing exercises are very good options to do. स्क्वाट्स वॉल के हेल्प के साथ, कैट एंड कैमल एक्सरसाइजेस, ब्रिजिंग एक्सरसाइजेस, जहाँ पे आपके बॉडी पे थोड़ा सा वजन आता हो, एक्सरसाइज खुद के बॉडी का वजन, वो एक्सरसाइजेस विल रियली हेल्प यू टू बिल्ड योर बोन डेंसिटी. So next question is, can you suggest me some remedies for backache? So backache, see, backache is again very, very common in females. I think a little bit more common in females compared to men. Workstation, computer, phone, and laptop. ये तो हम सभी के पास है. I think females have one more additional gift, which is pregnancy and postpartum and menopause. This is the phase again जहाँ पे हमारा core थोड़ा सा weak हो जाता है, and that's why we are a little bit more susceptible than others, right? So back pain के लिए कुछ चीज़ें. Make sure, again I'll say, कि आपका D3 का ध्यान रखो. दूसरा, make sure करो कि at least some mobility is done when you are pain free. Stick to any routine of exercise that is okay with you. Make sure it is exercise, it is not pickleball, table tennis, badminton. This all are games. ये सब जगह है जहाँ पे आपका मसल मास का खर्चा होता है. आपके पास जो स्ट्रेंथ है आप उसको यूज करते हो, इसमें आपकी कोई बॉडी बनती नहीं है. यस, आपके लंग्स एंड हार्ट की कैपेसिटी बनती है, पर अगर आपको बैक के लिए करना है कोई एक्सरसाइज, देन योगा, पिलाटीज, strength training are good options when you are pain free. But when you are in pain, then the best thing is to do is to start maybe with Ardha Bhujangasana or Bhujangasana. These are the safer ones to start with. Gradually you can start taking care of कि आप आइस पैक्स लगा सकते हो इनिशियली अगर अक्यूट पेन है तो. एंड मेक श्योर करिए कि कुछ चीज़ों का ध्यान रखिए कि इसको कम से कम ट्रिगर करिए. जैसे मैंने बहुत कॉमनली लोगों को देखा है कि बैक पेन वालों को सुबह उठ के बहुत पेन होता है, एंड सुबह उठ के स्ट्रेचिंग करना शुरू कर देते हैं. सो सुबह सुबह उठ के स्ट्रेचिंग करना इज़ वन थिंग दैट यू शुड नॉट डू, बिकॉज योर बैक इज एट इट्स पीक ऑफ स्टिफनेस. बिकॉज पूरी रात में आपकी जो भी डिस्क है, गादी है आपकी स्पाइन की, उसने पानी पी के वो मोटी हो गई है, बिकॉज इट एब्जॉर्ब्स वाटर. So first thing you do is when you wake up with morning stiffness is go and take a shower rather than start stretching. So give yourself 30-40 minutes before you start your workout in morning rather than just directly hopping to the exercise. Second thing is, जब भी उठते हो तो एक करवट पे जाके उठो, डायरेक्टली जैकनाइफ की तरह मत उठो, बहुत हैवी वेट्स मत उठाओ. स्टार्ट विद सिंपल भुजंगासन और अर्ध भुजंगासन, उसे दिन में 2 या 3 बार करिए. ग्रेजुअली थोड़ी बैक की स्ट्रेंथनिंग एक्सरसाइजेस करिए एंड देन मूव टू योर रूटीन. दिस इज ओनली फॉर पीपल हु हैव लो, थोड़ा बहुत बैक पेन कभी कभार. पर अगर आपको लगता है कि आपका बैक पेन क्रॉनिकली है, 2 महीने से है, जा नहीं रहा है, बैक पेन के साथ आपको बटक में पेन है, पैरों में दर्द है, या तो फिर टिंगलिंग, नमनेस, बर्निंग सेंसेशन होती है हाथ पैर में, then please खुद से exercise start करने से better है to go and meet a good physiotherapist or go and meet a McKenzie certified physiotherapist. They are the best ones to take care of your spine concerns. So there's this question which is that are there any easy exercises that you can do on the desk? So for this we have already made a video. It is still not launched. It will be coming up next week where we have put up that what are the five simple exercises that you can do on your desk. Uske alawa there is a carousel that has also been shared. I will share that link where we have put up that which are the simple exercises that you can do on your desk when you do not have to get up and you can do it for your mobility. But there is one more video also which is coming up next week. I will share that with you all. Okay, just give me a minute. Okay, so I had one more question which is asking that I feel weird heaviness or pressure down there by end of the day. And what is it and is it normal? So feeling a lot of pressure down there at the end of the day, or to feel heavy, or to feel pain, or you feel breathless when when you breathe deep at the end of the day, is typically there are chances that you may have some pelvic organ prolapse. This in itself, again, it's a very short statement to comment anything that why this is happening, but this is also one of the symptom of pelvic organ prolapse. So if you feel something popping out again when you strain, or you feel something popping out at the end of the day from your vaginal opening, or even if you don't feel anything and you just feel heaviness and pressure down there, I would suggest it's again good to get it consulted. Do not ignore this part of it. Okay, so I have this question which is like I'm leaking a bit of stool or gas since I have delivered. So this kind of incontinence is called as either fart incontinence, or it can be called as fecal incontinence, where a female ends up passing a little bit of stools, or it can happen to males as well, typically after prostate surgery or after any major pelvic surgeries, where they end up passing little motions even without intending to, or even when they pass gas, that's the time the little bit of motion passes out. This is typically again a sign of weak pelvic floor muscles, and yes, a proper rehabilitation program for the same and a good strengthening protocol can help. My sincere suggestion to all of you is that I do understand that incontinence may be toilet incontinence, may it be urine incontinence. There is something called as coital incontinence also, jahan pe while during sexual activity you end up leaking a little bit of urine. This all forms of incontinence typically comes under a umbrella of weak pelvic floor muscles. There are times when it can happen because of dysenergia या tightness also. So इसको सिर्फ ये समझ के blindly सिर्फ Kegels exercise से इसे treat ना करें. Kegels exercise is one of the most trickiest exercise that I have taught, or I think any physiotherapist would have taught. And even being a physiotherapist, I have seen a lot of times female who have weak pelvic floor muscle 80 to 90% of the time, however well you teach them, they end up doing it wrong. So Kegels exercise is one thing, sorry, until and unless not taught properly, not learnt under guidance, please make sure that you are doing it right. Rather, do not do it. If you feel that you started doing your Kegels and your symptoms worsen, it means you're not doing it right. Right? So rather, please get this consulted and do not start self-treating it. Even though Kegels also, it's best to get it learned once and then do it rather than just start. Right? Someone had also asked me that what are the common mistakes that we do when we do Kegels. So Kegels अगर आपने सीखी है, अच्छा जिन्होंने नहीं सीखी, I'll just quickly brief up what is Kegels. तो Kegels is a pelvic floor exercise जहाँ पे हम क्या करते हैं, we usually give a cue where we ask you to imagine as if you're passing urine, and if you want to stop the flow of it in between, what are the muscles that you're going to squeeze? So typically what you intend to squeeze at that point of time is nothing but the vaginal orifice, urinary or toilet orifice. That's all that you need to squeeze, right? Now, अगर आपको ये queuing भी help नहीं करती, तो you can always imagine as if there is a marble at the opening of the vaginal orifice, and if you just want to suck the marble in, what are you going to do? Maybe that might also help you to understand what you need to do. The third option is A lot of time we tell people that you go to the washroom, you try passing urine and stop the flow of it in between and understand what you need to do. So this what you do is actually Kegels. ठीक है. अब प्रॉब्लम्स क्या क्या होती है इसमें? सबसे बड़ी प्रॉब्लम ये होती है that people start doing it while passing urine. Now while passing urine, if you start doing your Kegels exercise, you got to do at least 100 reps a day. Imagine 10 times you stop while passing urine, you are never going to empty the bladder properly. It will end up giving you UTI rather than help you in any ways. So never do this exercise while passing urine, right? Second thing is, the most common mistake I've seen females doing is that when they try to do their Kegels, they start squeezing their abdomen, buttock, and legs. This is again where you are using a lot of accessory muscle as compensation because the pelvic floor muscle is not strong enough. If you feel that is happening with you, or if you feel you just end up holding your breath, or you feel you just end up straining, then this other times it's always wise to meet your pelvic floor therapist, learn under them once, and then do it at home, right? So I have this question, which is why do my heel and mid feet hurts after a long walk? Is it lack of exercise or lack of D3? See, the biggest question is how long walk. Okay, so if you walk for 45 minutes or if you walk for an hour and after that your feet and your legs starts paining or your mid feet starts paining, this may not always be D3. So D3, it's a part of routine anyways. I cannot even call it as lack of exercise because if you're walking for long, then probably you have habituated it to it and you are doing it. There are chances that you need to check is the balance of the strength of your leg muscles. There are times again the foot arch also matters. So people with flat foot or people with high arch foot do not have a compatible footwear can also end up giving pain at the end of the day after walking for long. So your footwear, your foot arch, your hip to leg alignment, and your core strength are another factors we can look into if the pain does not resolve. So I think only lack of exercise or D3 may not be the cause. Possible, but this needs to be looked into a little bit. If you feel it's really nagging and troubling, I think this needs to be looked into one on one. Okay. Okay, so I have this question: what are the best snacks for energy when I'm tired to cook? So typically, anything like a makhana or chana or a threepton biscuit or just sukha bhel. I'm purely talking about snack, or even a fruit before 6 o'clock. I think even banana or any seasonal fruits, or maybe just curd and some seeds in it can also help. They're all good snack options. I would really want to highlight is what are bad snack options. I think your protein bars are the worst snack option you can get. Extremely rich in sugar, filled up with preservatives. Rather, इससे अच्छा है कि आप दो तीन खजूर और dried nuts ही ले लो. That itself will give you the same thing. So, dried snack में again, chicky is also a very very good option for females. So there are multiple options. You can go with dry fruits, chicky, go on laddus sometimes depending on the weather and which part of your life cycle you are. So again, if you are pregnant, not really, but maybe postpartum, menopausal, go on laddus are amazing. So this all you can already pre-prep and keep it, and maybe that you can have it as a snack, but definitely something coming out of the packet are not a very great option. Okay, so I have this question that do I need extra protein if I'm breastfeeding and trying to work out? Right. So breastfeeding and extra protein. So breastfeeding, actually speaking, just requires extra 400 to 600 calories. Yes, when you're working out, maybe you can add on another 200 calories to it. Again, depends on what kind of workout doing you are doing. For breastfeeding, the key to success is to establish demand. Okay, so in your initial first 6 weeks post delivery, if you are able to latch the baby well, you make sure that you try not to add on formula feeds in between. Let's say if you have to add formula feeds in between, still you make sure that you latch your baby to the breast for some time before you give the formula feed. What you are trying to do is that you are trying to establish a demand. कि भाई body's demand is that we need to produce milk for 10 times or 12 times. If you have established a good demand, the body is irrespectively going to produce milk, even though calorie a little bit more or less. The few things that we need to take care is, yes, for a good milk production without affecting maternal health. So your body reserve should not wash out. That is the reason a meal which is rich in protein, calcium, and fiber is absolutely needed. So extra protein, maybe just maybe, so the math is that if you are not pregnant or if you are not breastfeeding, it's around 1 gram per kg body weight. So let's say if you're 50 kgs, then you need 50 grams of protein. But if you're breastfeeding and you're working out, maybe it is 1.2 to 1.3, not more than that. Rest can be taken care of just by the routine, right?
Last five.
Okay, so we have last 3 questions that we can take now. We're almost up with time. So there's this question which is, I have gap in my stomach muscles. Does it close completely? Yes, yes. See, the intention is to not close the. So earlier at the start of the session, I had spoken about abdominal muscle separation, which is called as diastasis recti. I think this is a follow-up question with that only. That usually a gap of more than 2 fingers is considered as diastasis recti. So when you work on your core strength, what you intend to do is the separated abdominal muscle, you try to bring it closer and you try to close that gap. Yes, with a proper systematic regime that can close, even though a little bit left out, a strong core muscle will hold it out, so don't worry. But do not ignore a more than 2 finger separation. Again, it's very easy to assess. What you need to do to assess that do you have diastasis recti or not is to lie down flat, bend both the knees, keep both the hand behind your head, and then just crunch. Do not crunch completely up, just bend your head a little and then just roll a little above from the floor. When you do this, place these fingers at your navel area, okay, horizontally, and then just check how many fingers are sinking in. If you feel that more than 2 fingers are sinking in, it's a good time to see your doctor. If you find this method hard to assess, even your gynecologist can assess this, physiotherapist can assess this, but usually a women's health physiotherapist or a pelvic floor rehab specialist are the ones who are best to treat it. Not a very great idea to start treating it with help of people who have once treated their diastasis recti. I think it's another trend lately. Okay, last question for the day. The question is, can my diet affect the frequency of my UTIs? I would not say diet really can affect the frequency of your UTIs directly. Your water intake can definitely affect the frequency of your UTIs. So, yes, not diet, but water intake can surely affect the frequency of your UTIs. So, make sure that at least 1.5 to 3 liter of water intake needs to be kept. Do not hit below 1.5 liters until and unless has been advised by your doctor. So I think I think we will have to wrap this session. And thank you so much for all of you who have been able to join the live session. Your questions made it special. I hope I was able to answer all of your questions. Still, if you have any doubts or you want to ask anything, we are dropping our contact in details. So you can mail us and we will answer back to you. And I wish that my motto is to have a more confident and a powerful, healthy aging. So I hope this has taken care of some of your fears and some of your doubts that you have been dealing with. So wishing you all the best and happy Women's Day once again. See you all soon. नहीं आ रहा है. So see you all. Take care.